subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We have the pleasure of hosting Dr. Siddhart Yadav today. Dr. Yadav is an orthopedic and joint replacement surgeon at the Apollo Hospital in Navi Mumbai, and he has over 25 years experience. A little about Dr. Yadav. He's done his master's in orthopedic surgery from the MGM Medical College in Indore and trained in joint replacement surgeries for 3 years under the guidance of the veteran Professor Dholakia at the Bombay Hospital in Mumbai. He was further intensively trained for a year in hip and knee replacement surgeries at renowned hospitals in Germany, US, and Austria. He's done special training in uncemented primary revision hip replacement surgeries and computer-assisted surgeries in Germany. He has worked at the Harvard Medical School, Boston and Beth Israel Medical Center in New York, and was trained in the latest primary and revision knee replacement, mobile bearing, high flexion, uni knee replacement, and cartilage repair surgeries. He was also awarded the prestigious AO International Fellowship at the University of Hospital in Austria and learned his latest techniques in complex fracture surgeries. He's a member of the Indian Orthopaedic Association, the World Orthopedic Concern, Bombay Orthopedic Society, and the Indian Society of Hip and Knee Surgeons. He's presented several papers in India and internationally, and we are delighted to have him for this session of Health Live. Welcome to Health Live at Seniors Today, Dr. Yadav. How are you?
I'm fine. Thank you very much for your kind invitation. For this is a very important topic, and I think without delay we can start on this.
Yes. So what we've done is we've invited Dr. Yadav to speak about ortho problems among the elderly during the winters. And as we know, we are in the winters. Even in cities like Mumbai, there is that chill in the air, which is pretty welcome for people in Mumbai city. But across the country, it is very cold, depending on which part of the country you may be in. And we've requested Dr. Yadav to speak about ortho problems for the elderly. We've had a variety of orthopedic doctors in the past, as we know, and but we haven't really discussed this issue specifically in the last 2.5 years that we've been doing the health webinars. So over to you, Dr. Yadav, and we've got a colleague of mine who will share the screen and help you navigate the session.
Thank you, Mr. Maheshwari. So I'm going to talk in very general, and so everybody can understand. And it's a brief talk, and yeah. So and then probably after this brief talk, we can have question and answer. So interactive. So can I have the first slide, please? So what happened commonly? As in winter, normally in this part of India, this is, I think, after many years we are getting temperature, which is coming 20 degree or less than 20 degree. So whenever there is drop in temperature, 20 degree, then this problem starts. What happened commonly, as our many patients, they are complaining, there increase joint pain, increase back pain, the stiffness in the joint, and also they face muscle cramps. Now, why this common in winters? Next slide, please. What happened in winters due to there is a low temperature, especially when the temperature decreased at least 10 degree in the atmosphere. There is also change in the atmospheric pressure. And in winter, we are moving out less. So there is an inactivity in our day-to-day activities, and we are less exposed to sunlight. So what happened due to this? Next slide, please. Due to low temperature, there is a reduced blood circulation in our joints, in our muscles, in our tissue. And also due to change in the weather, you say that nowadays the weather is changed, the atmospheric pressure is changed. The atmospheric pressure, it causes pressure on our joints, most of the joints, specifically if joints are arthritic or joints are already not normal. Like in elderly, they have some age-related changes. And due to inactivity, when we are not moving, we are not going out, what happens? We face stiffness of our joint. And in due to our inactivity, we are not going out, and sun exposure is less due to fog and due to weather condition, and we get vitamin D deficiency. Because what a vitamin D deficiency we get from sunlight. When we get at least 10 minutes sunlight exposure, that we get vitamin D. Vitamin D, our body cannot make it. It comes from sunlight. Sunlight, they come to our skin, and then vitamin D is formed. And vitamin D is very important because without vitamin D, whatever food we take, the calcium, it never get absorbed. The calcium does not go to deposit to the bone. Whatever, even if you are taking calcium supplements, if your vitamin D is less in your body, it will not get absorbed. So vitamin D is key for your calcium absorption, and calcium is important to make your bones strong. So this is one reason. Also, vitamin D is important for muscle activity because vitamin D is less, we get lethargy. So these are the reason why in winter, these joint problem, especially in elderly, because in elderly joints, they are already degeneration or aging process in progress. So they are more susceptible to it. Next slide, please. So what is the solution? Winter, because now maybe we are not in this part of India, we are not used to winter, but if you go to the northern part of India or the other part of world where there's a severe winter, they know how to deal with winter. Number one, stay warm. Your body should not get excessively cold. So you have to wear clothes, especially if you are sleeping. When we sleep at night, we should wear woolen socks. We should cover it properly because now what happened in our this part of like Bombay, we don't have proper woolen clothes also. We don't have jackets also. And sometimes we feel, let's go out, nothing will happen. But if your joint, if they are sensitive, if they are getting some arthritic changes, then they are very sensitive to cold. So please wear warm clothes. Number two is regular exercises. If you do regular walking, even if you are at home, you fix your time like 10 minutes. You have to walk indoor walking in room. You have to do certain exercises like moving your shoulders, elbow, wrist, and fingers. Also lying down on bed, doing some cycling. So you're moving your hips and knees. In that way, all your body joints, they are mobile. You are moving them. Due to that, there's a blood circulation increases in your joint and muscles, and you don't get stiffness. Next is because in winter, sometime winter is 2 to 3 months, we are not going out, and because of that, we start gaining weight. And that is another reason. If you put on weight, then especially on like knee joint and hip joint, knee joint is very sensitive to weight. Whatever weight you put on, like suppose you put on 2 kg weight, and almost when you sit down and get up, 4 times pressure or weight comes your knee joint. So if you put on 1 kg weight, you are putting excessive 4 kg weight on your knee joint. So losing weight is very important. Again, if you are putting weight, then you are putting more weight on your spine and you start getting back pain. So losing weight is very important. So you have to eat healthy for that, eat wisely for that. In winter also, as used to say our nani and nana, like in winter, eats ghee, nuts. So basically, all that contains omega-3 fatty acids. So nuts, and if you can't eat ghee due to some reason or nuts, then you have to take some supplement with contain vitamin B12, vitamin D, omega-3. So that kind of eat healthy and eat specifically in winter. And also in winter, what happened? We don't perspire. हम लोगों को sweating नहीं होता है. Then what we don't drink water at all. If you notice, your water consumption drastically reduces in winter, which is not good. For a healthy person, at least we have to drink 2 liters of water. But winter, at least we should not stop it, because if you stop hydration, that also have bad effect on our kidneys, our overall muscles, our system. Excuse me. So that is, hydration is important. Don't stop drinking water due to cold. You make, if you're feeling cold, make your water little warm and drink it. Next is vitamin D supplement, because vitamin D we get from sun, and the simplest way to get vitamin D is take supplements, which is very simple. Next, one more tip is hot water fermentation. If you are sitting at home watching TV, take a warm water in bucket or a small tub, dip your ankle, take a towel with hot water, put on your joint where it is getting. Also, massage, gentle massage is always better, not very harsh or hard, but gentle massage is good for joints, especially in adults. Thank you. If you have any question, please, I would that would be interactive, and I would love to do that.
Thank you very much, Dr. Yadav, for your short but very effective presentation. And I'm sure most of our viewers and our readers here have got all the information. I've got a few questions already. But those of you who have questions, as always, please put them in the Q&A tab, and I will address them to Dr. Yadav. Dr. Yadav, you're on mute.
Yeah. Please go ahead.
Yeah. Dr. Yadav, the first question that I've got is that I've got a bit of a cold thanks to the change in weather and the pollution levels in
everyone has got it. Me too.
The question that I've got, doctor, is that in the cold, is it good to cover your neck and your ears? Because that is what gets affected first, and sometimes one gets neck pain as well. Is that a problem with the cold, or is it because of any orthopedic thing that person has asked?
No, it is absolutely. We have seen in the past also, when we were small, our grannies used to cover your ear and neck, and there's a scientific reason. What happened? Your ear, if you see, in your ear there's an eardrum, and directly there's an internal ear, and which is connected to your brain. So it's very internal organ, which is exposed. It doesn't have any covering. So definitely our ear, they are very sensitive to temperature. They are very sensitive to the pressure, atmospheric pressure. So if we cover our ear, I think it is better. Secondly, neck also, because what happened, neck again, they are all the important blood vessels, the supply which is going from our heart to your brain. They are very superficial. You can feel on your neck, and again here, and there's also the main artery is there called carotid artery, which takes blood from your heart to the brain, and that also has special receptors which are sensitive to the pressure. So that also get affected very quickly with the temperature, and that is also one way our body get adjust to it. Like now it is very cold and we have to protect ourselves. So it is better to cover ear or neck in a severe cold.
Right.
Thank you.
Thanks, doctor. We have a question from Mr. Dibyendu Ganguly, who's a 63-year-old. His question is, what is the best supplement form of vitamin D? He says, I've tried taking granules in sachets, which is a bit of a hassle.
If you ask me, the best way to get vitamin D is from sunlight, 10 minutes every day. And if you can't, then best way is vitamin D, cholecalciferol. See, all vitamin D, they have only one component, cholecalciferol. And that comes in granule also. that comes in capsule also, but the content is only one. Okay, vitamin D. There is no different kind. Now some companies, they have made it a liquid, some made it a granules, and in granules, if you are taking like sachet, then ideally we should mix in a little milk, because this vitamin D is a fat soluble vitamin. If you drink in water, it doesn't dissolve. So milk, little milk, 1/4 of a cup of milk, mix the granule, then drink it. That is the best way. Second, if you are taking a capsule, then that you can take with water. And third, liquid itself is a fat soluble or fat based liquid. You can drink like regular directly. Okay, so all three, capsule, liquid, and powder, we have to take it differently.
Doctor, I remember having taken some vitamin D supplements, and the doctor advised me that, don't take it for too long. Put a gap or check your vitamin D levels through a test. What is the best advice for that?
Ideally, we require in a year, we have to calculate yearly how much dose is required. So every year we require at least, if you say minimum 6 lakhs unit, 6 to 7 lakhs unit. So you can calculate, every day we require 2000 international unit of vitamin D. So if you are taking 60,000 capsule or sachet, in India it comes into 60,000 units. So in a year, you can have 10 sachet or 10 capsule. So total, you can have at least 6 lakhs unit. That is the minimum requirement. Maximum you can take up to 12, So up to 8 lakhs international unit is safe. We should not take too much beyond 10 lakhs unit. Some doctor or some people, they advise injection. Now one injection has 6 lakhs unit. So one injection ideally is sufficient for almost 1 year. Now, if you take too many injection, like 3 injection or if 5 or 6 injection, that can be harmful.
Right. Thank you for that tip, doctor.
Yeah. So everyone has to calculate. They have to take 6 to 8 lakhs maximum vitamin D in a year. If you take more than 10 lakhs, it is harmful to your kidneys. One should not take injection. We should avoid injection as much as we should. Vitamin D injection we should not take.
So doctor, what does a person like yourself do? Because you are obviously in the hospital most of the time. So do you also?
I take supplement every month, 60,000 unit, one vitamin D capsule I take every month. So then I don't forget.
So you remember the day that you have to do it.
Yeah, the best thing is in your family, you put in your calendar, like entire family should take vitamin D once in a month.
That's a good tip.
That's
doctor.
Good tip. Yeah.
Doctor, we have a question from Mr. Rajiv Kumar. He says, post TKR, how long does the pain last? Besides painkillers, any other ways to reduce pain? I know this is not something given our topic, but I guess since they have an orthopedic in the house, they're asking this. Sleep is so I'll just repeat the question. Post TKR,
I understood.
And besides painkillers, are there any other ways to reduce pain? Sleep is also very disturbed. It's been 6 years post surgery, and he is 65.
So, see, I would, so to answer him precisely, after TKR, pain happens in every patient. Okay. There are 3 reasons of pain. Number 1 reason of pain is any surgery when we do, we cut some like skin, muscle, and soft tissue, and that healing takes at least up to 2 months to 3 months. Okay. So 2 to 3 months, some kind of stretching pain do happen. The other reason of pain is when we are putting foreign body inside, the body get used to it, and it's again takes 3 months. So 3 months is minimum, and that's why for first 3 months our knee is also warm. So 3 to 4 months, people do get pain. However, sometime some people may get pain up to 6 months. But this pain is very specific. This pain is not on walking. This pain is not on knee bending. This pain is kind of ache. They get aches, like sometimes they are getting ache at night or after exertion. If they are getting regular pain on walking, on bending, then we should check if there is any complication.
So we have the question about, we've taken a few questions now. So we have two questions that have come in. One is from Mr. Bharat Mehta, who's 66. Yeah. He says, what is the best exercise to keep our physique bones strong? Any vitamins and tablets to keep oneself fit? The other question is from an anonymous attendee who says that, Dr. Yadav, since winter happens every year, is there something that we should do just before the winter every year in the form of exercise, in the form of vitamins, in the form of a regimen that we can ensure that we can brace the winter very well? Some of these words are mine, but this is the question.
So I think first part is, can we prepare us for the winter?
That's right.
I think we have to just preventive is like, we have to make it like a good habit. You have to do it continuously. You can't you can't get your immunity just in a 1 month or so. You can't reduce weight in a 1 month or so. This is a process. The healthy lifestyle, the preventive lifestyle is a process. So we have to continue it. My advice is throughout the year. And then when winter comes, your body will be fit to face it.
Right. Thank you. Doctor, there's KT Dholakia, who's again one of our regular attendees. She says, Doctor, is it okay to take Uprise D360K once a month and also take Shellcal CT 500 daily? She adds, my husband gets cramp in the night in his calf muscles throughout the year off and on. What should be done for that?
Vitamin D, as I told you, 60,000 units once in a month. It's okay to take it once in a month regularly if you are taking for a year. Now, any form of calcium you can take it, but their calcium they come in two kind of chemical composition. One is the calcium carbonate, other is calcium citrate or calcium citrate acetate. So calcium citrate is better than calcium carbonate in terms of absorption, in terms of any gastric symptom, some side effect. So whatever calcium you take, if you take calcium citrate, it is always better. Now, other part of the question, I think getting cramps. The cramps could be in low calcium or could be low vitamin B12. So if they are taking calcium regularly, then they should also take vitamin B12 along with it to solve their problem.
So is vitamin B12 injection or tablets are fine?
Vitamin B12, if you do a test and it is significantly low, then we can take 2-3 vitamin B12 injection intramuscular. If we do not check your blood level, then it is better to take oral capsule of vitamin B12. Okay.
Thank you, Doctor. Doctor, we have a question from Mr. Sri Krishna Agarwal, who is 66, who's 76-year-old. Right lateral condyle depressed, operated, Platubex. He says he can still feel the pain sometimes. What kind of medication should he take? His question is.
So I think his question is, he had a fracture around his knee and now he's it is painful. So pain is accepted, or it is sometime happens up to 6 months. If they are getting pain more than 6 months after fracture, then we have to check it whether the damage is increased or whether any other remedy is required. I think one must consult orthopedic surgeon, do the X-ray, and then further decision can be taken.
I have a question from Mr. Narendra Shah. He says he's had knee replacement both his knees. His question is, what is the life of a replaced knee?
So life in terms of, we say survival. Okay. The survival typically is 95% survival at 10 years, around 90% survival at 15 years, and around 80% survival at more than 18 years or more up to 20 years. So that is, if you do 100 knee joint, 95% will survive at 10 years, 90%, 90 of out of 100 will be there at 15 years, and more than say around 80% will be there more than 15 years. So this is, but another thing or another way of thinking is the average age of this operation in India is around 65 years. So if you do a operation in a 65 years, then most of them, they won't need a redo or revision surgery. Revision or redo surgery mostly happens when this knee replacement we do at an early age, like due to some rheumatoid arthritis or some other condition. If we are doing knee replacement, which is unavoidable at the age of 40 years, then I can then it is possible at the age of 60 years a redo is will be required. But in a senior citizen, after 60, if you do a very well done knee, mostly they don't need a revision knee replacement. All right.
Thank you. We have a question from Mr. Brij Dukal, who's 79. He says, for the last few years, my walk is not steady. I wobble while walking. He
Right.
says, I do walk, do yoga, but wobbling continues. What is the preventive action?
So there could be two reasons of his wobble gait. One is wobbling at the knee joint, where when he walks, his knee wobbles, knee shakes, and he's not able to walk. Another reason is if his knee, hips, and spine, they're stable, and still his imbalance is there. That means the imbalance is from the head center, from the center, that is from the brain. And that we have to check out from a neurologist, what is the reason of his imbalance. So I would advise him to consult neurologist if he's facing imbalance, because imbalance in elderly it can be due to a lack of circulation to brain, some neurological problem, and we should not ignore it, because this imbalance leads to fall in elderly, which is very common. And after that, they get most commonly hip fracture in elderly is due to fall or imbalance. So I think he should get checked. It is very common to get imbalance and fall after that. Those who are about 75 or at 79. Okay.
Right. Thank you. We have another question, which is again on TKR. I'm 65. My body weight is around 93. No BP or no sugar. Maintaining good health. August 2022, he had undergone TKR. He is now walking daily for 4 to 5 kilometers. But however, there's a slight crackling sound in the knee. Is it normal? If not, what are the precautions he should take?
See, crackling sound is not to worry if it is not with pain, If it is a painful crackling sound, or if he's getting pain when walking or putting weight, that means his knee joint, they have age-related wear and tear. And then we have to do the X-ray to see whether it is really wear and tear, what is the stage of arthritis. And it is not necessarily everybody needs TKR, those who are getting crackling sound or knee pain. There are various remedies for that. TKR is done only in stage 3 or 4. That is in the end, when the other treatment, they are not effective. I would advise to go do a X-ray, standing X-ray, and consult orthopedic doctor.
Doctor, thank you very much for all your responses. I think we've answered quite a few questions despite the slight break. And thank you very much for coming back. I know you were on the way from the hospital, and now I think you've come back to the hospital, and in your office. Thank you very much once again, Dr. Yadav, for being here. And thank you to Apollo Hospital for facilitating this. We will be back once again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. As I mentioned, it's World Cancer Day next Saturday. So we will have a cancer specialist in the house. And Doctor, I have two more questions. Although I have thanked you, can I ask those questions?
Yeah, most welcome.
So there's a question from Nisha Kumar. These are new age circumstances. So when can one start driving after TKR?
Yeah, typically, once they regain their strength and mobility, when they can climb stairs, they can move out. So it typically takes 6 weeks, is the minimum time. After 6 weeks, most of them, if they are driving before, they can start it. So 6 weeks is, I think, average time. Some people can do it a little early if they are very active. And some people, if there are some other issues, then maybe a little more time. But 6 weeks, normally one can do it.
And Doctor, one last question. This is again from Mr. Brij Dugal. He says, my wife, 75, cannot stand at one place for more than a few minutes. She trembles. What should he be doing?
So there are 3 reasons. There could be. One is whether it is related to hip and knee joints. If they are painful, then she cannot stand. Second is the spine. If he has spine problem, again, she cannot stand erect for a long time. And third is her brain. If something wrong in the balance, because balance is done by our brain. So these 3 things should be checked.
Right. Thank you very much. Thank you very much once again, Dr. Yadav, for taking time out on a Saturday evening and being with us for this Health Live session. We have received a few questions, like Mr. Suresh Ghate has asked about vertigo, and I see that there are some neuro-related questions. So we will have a neurosurgeon soon, and who will advise on neurological issues. But as for today's session, we are so thankful to Dr. Siddhart Yadav for taking this session and to for facilitating this. And we will be back once again next Saturday, that is February 4th at 5 p.m. for a session on a special session on World Cancer Day. And we will meet you then. Thank you once again, Dr. Yadav, for this session and for taking your time out.
Thank you very much. If any other queries there, you can email, and through you they can email, and I would be happy to solve their query. Thank you very much.
Thank you very much. Thank you very much.
Thank you.
Subscribe now and press the bell icon. Never miss an update.